Okay, students, good morning to you.
Good morning, ma'am.
Good morning. Yes, assalamu alaikum.
Walaikum salam. Good morning, ma'am.
8 students. Yes, you are 8 students here. Okay, let's check. Umar Muhammad Bilal. Umar Muhammad Bilal is absent. Dinzia Mohi.
Yes, ma'am.
Han Murtaza.
Yes, ma'am.
Hayat Ahmar. Hayat Ahmar absent. Hassan Amar.
Yes, ma'am. Present.
Ibrahim Hamid.
Present, ma'am.
Okay. Zishan Muhammad.
Present, ma'am.
Shahab Laiba.
Present, ma'am.
Present. Javed Usfa.
Present, ma'am.
Present, ma'am.
Abdul Rahman Fajwa.
Present, ma'am.
Present. Okay. Here, Shahab Laiba and Javed Usfa. You and who? Zishan Muhammad. You have 3 absents. And you have to clear, yes?
Ma'am, sorry, I was ill last time, so I can't join my class because
Why?
I was sleeping due to illness.
Due to illness in last week?
Yes, ma'am. Sorry, ma'am. I will next time, inshallah, I will present. So please compensate my attendance kindly. Thank you, ma'am.
Zishan Muhammad, yes?
Yes, ma'am.
And Shahab Laiba, Javed Usfa, what about you?
Ma'am, due to some personal issues, that's why.
Why? Again, please, why you couldn't attend?
Ma'am, due to some network problem. Ma'am, some family issues, that's why I don't take class.
Okay, students, or two absence, yes, I can allow to first module if you have 2 absent, but 3 and more, I will not allow. So you look the date when you were absent and the topic of that day, yes. And on module there are tasks for you. Did you see them? There are tasks and quizzes. Quizzes, of course, you will solve, but tasks for those who who has that absence. Okay, you have to write, answer these questions and send, write on your book, notebook. Yeah.
Okay, ma'am.
Okay,
Ma'am, kindly. This is last chance for us, please. So compensate our attendance, please.
Yes, ma'am, please.
Next time we will present, inshallah, ma'am.
Yes, ma'am, inshallah.
Of course, you will present.
Thank you, ma'am. Thank you so much, ma'am.
Today, which topic have you prepared for today?
Cardiac cycle, ma'am.
Cardiac cycle and ECGs, electrocardiogram. And in your lectures, what was given yesterday?
By whom, ma'am?
Ma'am, this ma'am has some issues because ma'am cannot deliver well lectures and we cannot understand this, ma'am.
Yes, Dr. Regina, yesterday, did she
Yeah,
say
Yeah, I
ma'am.
think they just
Coordinator,
give
I have
excitation
also
of heart.
issue.
what again?
Excitation of heart, ma'am.
Excitation.
Arrhythmic excitation of heart.
Ma'am, but that was little bit, so we can't.
Mhm. But we have discussed yes this excitation in our practice class. And yes, we have remaining 2 topics from cardiovascular system today, and next class we will discuss regulation, and then we will complete and start next system. It is respiratory system.
Okay.
Okay.
Okay, ma'am.
So who's ready for cardiac cycle and ECG? Who will start?
Ma'am, first start about the cardiac cycle because most students focus on this topic.
Yes, I will start. Yes, I will explain if I see that you don't understand anything. Okay. Before, yes, I want to ask some students who did read.
Yes, ma'am.
Okay, ma'am, you can ask a question.
Ma'am, you can ask.
Okay. So, cardiac cycle. How can you calculate the duration of cardiac cycle? Duration of one cardiac cycle.
Ma'am.
Wait. Yes. Duration of cardiac cycle. What is cardiac cycle and how long does it last? Yes, students.
Yes, ma'am.
Cardiac cycle, what is it?
When cardiac cycle is equal to the one bicuspid or tricuspid.
Ma'am, cardiac events that
And
occur from the beginning of one heartbeat to the beginning of next.
Next, yes. So from the beginning of one to the beginning of the next, yes. And yes, you can see it consists of systole, yes, one systole
Diastole.
and one diastole. Yes, systole, it is contraction of ventricles.
Diastole.
Diastole, it is relaxation. Yes, we say this according to the ventricles. Okay.
Yes, ma'am.
And how we calculate? Yes, we divide. It depends upon heart rate. If heart rate is increased, then cardiac cycle it's shorter. Yes. If then
Yes, ma'am.
heart rate is rare, then one cardiac cycle is longer. So we divide 1 minute or 60 seconds divided by heart rate. and you will find one cardiac cycle. Okay, so approximately, yes, we take this as 0.8 seconds. And you can see we can distribute this time between atrium, yes, and the ventricles. And you can see what chambers, they spend more time in the diastole, yes, diastole. You can see contraction of atrium, it is 0.1 second, diastole, it is 0.7, yes, total it will be 0.8. In ventricles, you can see 0.3, it is systole, and diastole, it is 0.5. Okay, and from here you can see also atrial contraction, yes, and then ventricular contraction. And there are periods, yes, of cardiac cycle. Do you know about this? We
Yes,
have
ma'am. Yes.
period of isovolumic or isovolumetric
Yes, ma'am.
contraction.
Yes, ma'am.
Yes. Period of ejection, yes.
Yes, ma'am.
Rapid ejection, slow ejection, and ventricular relaxation or systole or diastole. Yes, this is diastole. It has also periods, protodiastole, period of isovolumic relaxation, feeling phase, yes, rapid feeling, slow feeling, and last one, it is atrial systole, yes, during relaxation.
Ma'am,
Yes,
I have a question, ma'am.
yes, you may ask.
Ma'am, why we say that in right side of the heart we have less pressure as compared to left side of heart?
You should, yes, you know that it is logically, if you think, yes, the systemic right side, right ventricle, from which starts pulmonary circulation, and left from which starts systemic circulation, yes, systematic. So in the systemic circulation, it is long circulation, yes, long circulation, and blood flows through all your parts, yes, and of course, to deliver blood to all your parts, the pressure must be higher, yes, pressure must be yes, pressure is the main driving force, yes, and to drive the blood through all your body, it must be higher.
Yes,
And yes, of course, left ventricle, it is thicker, yes, thicker, more muscles, yes, there are allocated more muscles than in the right atrium, or so right ventricle. So when it contracts, left ventricle, it of course creates more pressure, yes, with more force, and creates more pressure.
But ma'am, if the heartbeat is increases of any person in pathological condition, then what should we have to give to that person?
What should we give?
Yeah, to that person as a medicine or as a drug. If heartbeat of any person increases, as we know that athletes have normally, but in pathological condition we can say in pregnancy heartbeat is increased. So what we will give them, what we can
Yeah.
advise them.
Do you have a pharmacology? Not yet, yes, you don't have pharmacology now.
Okay.
Not, yes, the subject pharmacology you don't have now, yes.
Okay, ma'am.
What? Okay, I am asking.
Yes, ma'am.
Yeah,
Pharmacology,
we
you
don't have pharmacology. Yes,
Yes.
I know, but I just ask as usually. It's
Ma'am,
okay.
he's just general knowledge.
Just information,
Generally, I
ma'am.
just want to know.
Yes, you have problems with relatives with heart problems.
No,
Or
ma'am, I'm
what?
just asking if someone have more heart rate than what we should give.
There are, yes, you can take medicine also, and you can also physiologically vagal vagal procedures, yes, which will stimulate your nervus vagus. Or you can take advice beta blockators. These are a group of medicine that block the adrenergic beta receptors in the heart, yes, in the heart muscles. And you will see that there will be decrease in heart rate. These are what bisoprolol, yes, bisoprolol, atenolol, this kind of. Yes, it depends. Yes, there are another drugs which also decrease heart rate, and it depends upon what disease, current disease which he has. Yes, upon the age, pressure, and etc. Okay, there are lots of groups which decrease heart rate and pressure. Okay, so that's why you look a person, yes, whom you are advising the drug, and his other current diseases. Okay, is it clear?
Ma'am.
Yes, ma'am.
Yes, mostly these are beta blockators which decrease heart
Now, what
rate.
is isovolumetric contraction?
Yes, isovolumetric contraction. Yes, this picture, can you see it clearly?
Yes, ma'am.
Yes, ma'am.
Yes, this is a volume pressure loop in ventricles, and it is easy to understand cardiac cycle with this loop. Okay, and yes, here also, yes, here also. the same, yes, picture. And let's start with what, contraction or relaxation?
Contraction, ma'am.
Okay, contraction starts with the C points. Okay, from C point, what isovolumetric contraction? Yes. What does iso mean? Do you know?
Same, ma'am. Same.
Same of what? Iso volume, same volume. It means
It
same
does
volume,
mean the
or
same, ma'am, because when both valves are closed,
And
the
contraction.
aortic valve and mitral valve, then the volume of the left ventricles remain the same, and they are just relaxing and act as a single chamber, and we call them as a
yes.
isovolumetric contracting phase.
Yes, from C to D, this is a period of isovolumetric contraction. In this period, yes, there is the same volume of blood and the same length of the cardiac muscles. Yes, you can see here from it begins after diastole. Yes, when during diastole, muscles relax and there is elongation of their length. Yes, during relaxation, but when start isovolumic contraction period, these muscles contract, but there is no change in the length. There is no shortening of their length. Okay, that's why we say same volume of blood and same volume of length, cardiac muscle fiber. Okay, length of cardiac muscle fiber remains the same, and that's why pressure inside ventricles rises up to 90 maximum, yes, 90 millimeters of mercury. And blood, the amount of blood in ventricles.
It'll go to, ma'am, when it rises to up to 41 mm of the mercury, then the aortic valves are open and the
No,
blood
wait,
is
wait. We are discussing volume of blood in
Yeah,
ventricles.
120 mmHg, I think. So from 0 to 120 mmHg. And the
Not,
volume,
sorry.
pressure, it's pressure, ma'am, it's pressure, sorry.
Yeah. And volume?
Volume, I think it will be 5 liter, ma'am.
volume
No,
remains
120 milliliters in each ventricle. Okay, there are
Yes.
120 milliliters of blood in ventricles, and we call this end diastolic volume. Yes, during at the end of diastole, when ventricles are fully filled with the blood, yes, we call this end diastolic volume, and it is around 120. Okay, and pressure in this period, it is maximum 90.
And what
Okay.
and which and ventricle, ma'am?
Yes, in ventricles.
Okay.
In ventricle, yes, they contain 120 milliliters of blood.
Ma'am,
And
the pressure is also, ma'am, I think the pressure is also goes from 0 to 120 mmHg.
yes, during next phase, yes, it happens during next phase, but during isovolumetric contraction, pressure rises only up to 90 millimeters.
But ma'am, 90 is greater than aortic pressure. Aortic pressure is 80. So if there is 90, the aortic valve will be open at that time. If it goes to 90.
No, in 80, it is during diastole, okay, but during systole, yes, during systole, pressure,
Yes, ma'am.
more pressure in aorta is 120 during systole also.
Yes.
Okay, so this the first period of systole, yes, isovolumetric contraction, and then begins the next period of systole, which is called ejection period. Yes.
Okay, ma'am.
Yes, during ejection period, yes, pressure rises more than
Yes.
190. Yes, it increases more because there is shortening of muscle length.
Yes, ma'am.
Okay, muscle
Yes, ma'am.
length. Yes, and that's why pressure rises more, and it can reach up to 120. Yes, maximum. And yes, when pressure rises more, it opens aortic valve. Yes, and
Yes,
blood
ma'am.
is ejected. Yes, that's why we call ejection period. Yes, blood is ejected from ventricles into aorta. Yes, and in the
Yes.
aorta pressure, yes, systolic pressure, it reaches 120.
Ma'am, how much percentage of blood is ejected from
Yes.
ventricles
Mm-hmm.
during a systole
During
and
systole,
diastole?
yes, from 120, there should be pumped.
Ma'am, percentage of blood from ventricle to aorta during ejection.
Ejection fraction, it is a relation between blood which is ejected from ventricle and total blood which was in ventricles. Yes, so stroke volume, it is the amount of blood which is ejected from one ventricle. Yes, from one,
Yes,
yes, per one beat. Yes, and it means, yes, in the ventricles,
yes, ma'am.
some amount of blood, yes, they are not fully emptied.
Ma'am, I think during one systole 60% and in diastole 70%.
What in diastole?
Ma'am, diastole is 60% and systole 70% blood is ejected.
Ma'am, you
From
want to say
ventricle
that
to aorta.
during contraction 80%, then during
Yes,
relaxation
ejection fraction,
70%.
yes. We have ejection fraction, it must be more than 55% in normal, yes?
Yes, ma'am.
More
Yes,
than
ma'am.
55% of total volume should
Yes,
be
ma'am.
ejected in normal. If it is less, then it means that we have disorders of contractility. Yes, heart is not contracting properly. Yes, we call this, yes, when ejection fraction, yes, that's why ejection fraction must be more than greater than 55%. And yes, so we see that 70 blood is pumped, and in ventricles remain it how many?
30%.
No, from 120 milliliters, pumped only 70,
Ma'am,
and remain it
50 ml of human blood. And we
yes.
call them as end-systole volume.
Yes, and systolic volume. Yes, 50. It is end systolic volume at the end of systole. Yes, that's why end systolic volume. Understood? So after that, yes, this is end of systole. Yes. After that starts relaxation period. Yes, or diastole. Understood, students? Now about diastole. Wait. Yes, diastole begins with the period of isovolumetric relaxation. Okay, and this starts from F point. Yes, from F point till C point. Yes, till C point. Okay.
Yes, ma'am.
Yes, at the end of systole, in ventricles remain 50 milliliters of blood, and muscles start to relax. Yes.
Yes.
Start to relax, but yes, that's why pressure inside ventricles start to decrease. Yes, from 120 it decreases till how many? Around, yes, 8 and 10. Okay, 8 and 10 during first period of relaxation.
Relaxation.
Yes. In this case, what when pressure decreases below the pressure in our aorta, aortic valve closes.
Mitral.
No, aortic valve closes. When pressure in ventricles becomes less than in aorta,
Then the
yes,
mitral valve.
aortic valve closes. Yes, mitral valve opens when pressure in atriums becomes more than in ventricles. Yes?
Yes, ma'am.
But yes, it is still 89. It is, yes, it is greater than in atriums. Yes, in atriums, how much pressure? 6 and 8, yes?
4 mm of mercury, I think, ma'am.
Oh, yes, 4 and 6. Yes, 4 and 6. Yes, but yes, in this isovolumetric relaxation, all valves are closed. Yes?
Yes, ma'am.
All valves are closed.
And
And
call them
muscle.
isovolumetric relaxing phase.
Yes, isovolumetric. There is no change of the volume. Yes, in ventricles there are 50 milliliters of blood, and muscle length doesn't change because there's no still they relax but no elongation of the muscles.
Yes,
Okay.
ma'am.
Yes, that's why isovolumetric relaxation, same volume and same length. And next phase, it is called filling phase.
Yes, ma'am.
Yes, during filling phase, muscles relax with elongation. Yes, they increase in the length, and that's why pressure decreases up to 0. Yes, up to 0. So this pressure becomes less than in atrium. Yes.
Yes.
And that's why what?
Mitral valve open.
Mitral valve opens. Yes, and blood suddenly rushes into ventricles. Yes.
Yes.
And ventricles start to fill with blood. Yes, there is rapid filling and slow filling phase. Yes, rapid filling, slow filling, and yes, 70-80% now are blood.
Oh,
Yes,
before atrial contraction.
yes, flow into the ventricles, and final 20% of blood flows is pumped. Yes, when atriums contract. Yes.
Yes, ma'am.
So this happens at the at the end of diastole. Yes, it is around here. I guess. Okay.
Yes, ma'am.
Understood. Yes, this cycle.
Yes.
And after that, yes, begins again isovolumetric relaxation. Yes, from C to D point, and pressure in ventricles rise. Yes, and when pressure becomes greater than atrium, then mitral valve closes. Okay.
Yes, ma'am.
Yes. Here now, please relate the heart sounds in this picture. in which point you can hear which heart sound?
Yes. Closing of mitral
Next,
valve.
love and dub. Closing up mitral
Yes.
valve produce love, and closing up aortic valve produce dub. There are two sound.
Mhm.
We can simply say mitral valve can produce S1 and aortic valve can produce S2.
So can you say me the letters points here?
Ma'am, what?
Okay.
Point at which point? Yes, can you see the letters in the picture?
No,
A
ma'am.
B C D, A B C
And this
D.
at C point, no mitral valve. I think
Yes, at C point.
it produce love sound, ma'am.
Yes.
And
At
at D
C
point,
point.
and at D point, no, sorry, when aortic valve closes at F point,
F point. Yes, at F
it
point there will
produce
be. Yes, S1 it is at S point.
C point,
S2 it
yes,
is
F point.
F point. And what about S3 and S4?
S3 and S4, S3 normally an athlete person. When we exercise, when we run, then our heartbeat increases. S3 will produce their time, but S4 is a pathological condition. When the I think we can say blue baby syndrome, ma'am. When no, it's not in. Yes, I think
No.
when
Ma'am, S3,
Yes,
yes. Yes,
in
he
normal
said.
conditions also we can hear, but rare. Yes, only in young people and with what thin. Yes, we who are thin. Yes, we can hear these physiological heart sounds, S3 and S4. But mostly, yes, we don't hear.
S4 is normally in pathological condition, ma'am. I think so.
Yes, in normal also we can hear that.
Okay, ma'am.
So in normal, yes, when we hear S3 and S4.
When we hear, ma'am.
Yes, ma'am. I can. Ma'am, when we do some like heart exercise or any kind of working, then actually the blood is coming forcefully from our left atrium into the ventricle, and it produces a sound which we call them as S3. And if we're talking about that, how S4 is produced, then it is and then it may be due to any pathological conditions, and it is due to when our hypertrophic ventricle, when it is completely filled, then the atria is forcefully pushes the blood. We can say that extra blood by its contracting very forcefully, and which also produce a sound which we call them as S4 sound. And this is not a normal symptom. It may be a.
No, yes. In normal conditions, yes, we hear but rarely. Okay, S3 we hear when during early feeling phase, when blood suddenly rushes into ventricles.
Yes.
This amount of blood will cause vibration of ventricle wall. Yes, we hear at this point we hear S3, and S4 we hear when atriums contract. Yes, at
Yes.
the end of diastole, atriums contract and pump yes, another portion of blood into ventricles, which cause also vibration of walls. Yes, walls of ventricles. That's why we hear S4. Yes, this is in normal conditions, but we hear S3 and S4 very rare, and mostly we don't hear them. And when we hear it in early, not in old ages, yes, we can understand that there is, yes, pathological process. Yes, there is cardiomyopathy. Yes, the walls of chambers get weaker. Yes, and that's why we can hear this vibration. Yes. Okay, is that clear with the cardiac cycle?
Yes.
Okay, now we have
Yes.
also another pathological, no, sorry, I wanted to ask, yes, I wanted to ask about time at which close atrioventricular valve and our semilunar valve, do they close at the same time?
What, ma'am?
Ma'am, the mitral valve
Yes,
and
ma'am.
tricapsid valve, they close at the same time, and also the aortic valve and the pulmonary valve, they close at the same time.
Yes, ma'am.
Mhm. Yes,
As a
mitral and
both valve.
tricuspid, yes, there is no time what difference, yes, between closure of them. But about semilunar, there can be physiological splitting.
Yes, ma'am.
What is physiological splitting? Splitting of S2. Sound splitting, do you know?
Split sound splitting mean maybe occurring it more than one time or in a splitting with the meaning of splitting is that, ma'am, we can break anything in pieces. Yes.
When happens physiological splitting? Splitting of immune exactly S2, yes? S2. Semilunar valve, aortic valve and pulmonary valve, they might close not at the same time, yes?
Yes, ma'am.
So aortic valve close first and then
Then pulmonary valve or lunar
yes,
valve.
closure of pulmonary valve can be delayed, yes, for some seconds.
This is splitting of S2, ma'am.
Yes, splitting of S2. Yes, physiologically it can be seen when during
What, ma'am?
in which conditions? Yes, there can be physiological splitting.
During inspiration.
Yes, during inspiration. Yes, during inspiration, what happens? Venous return increases. Yes, during inspiration,
Yes, ma'am.
venous return to right atrium increases. Yes, during breathing cycles. Do you remember?
Okay, ma'am.
Yes, this in right atrium there will be more blood than in the left atrium. Yes, and that's
Yes.
why yes, when it pumps, yes, also in right ventricle there will be more blood. Yes,
Compared to left ventricle.
pressure rises. Yes, and the contraction of finish of contraction of left or right ventricle can be delayed. Yes, for some seconds, and that's why as it can we can see we can hear splitting. Okay, and what
Ma'am,
about murmurs?
Ma'am?
What is
during
murmur?
expiration, during expiration, splitting happens or not?
During expiration? No, no,
Splitting.
no. During inspiration only. When
Why, ma'am?
venous return increases. During expiration, the same. Yes, the volume of blood is the same. That's why
Okay, ma'am.
they contract and relax. Yes, similarly.
As you say that the various means the blood is more coming from the inferior and the posterior vena cava into the right atrium. Ma'am, I think it's only happen when we do some exercise, some hard working. Then more blood is coming from the venous into the right atrium, and more blood is going into the left ventricle, and so the heart, the speed of the heart is also increased, so that to apply or to maintain that the amount of blood which is going or which is coming from the right ventricle into the left atrium, and from left atrium into the left ventricle, it may be its amount may be controlled. The amount of blood which is coming, it may be completely pumped into the body. So I think there is no large difference between the concentration side, the both sides of the heart.
Yes, no, you don't mix. Yes, we said yes. Exercise also can be yes. During exercise, you also breathe. Yes, there will be inspiration and expiration. Yes.
Yes. Yes.
Yes. So we're talking about inspiration, yes? In normal, when you don't exercise, yes, there is also inspiration and expiration, yes?
Yes.
Yes, so we are talking only about that. During inspiration, what when you compare inspiration and expiration, yes, Venus return is larger, yes, larger, greater, I mean greater than during expiration. Because it doesn't matter, are you exercising or not exercising?
Yes, ma'am. Okay.
Yes, of course, during exercising, yes, this venous return increases greatly, but the amount of blood will be also after a gas exchange, yes, it also returns to the left atrium, yes, this amount of
Ma'am,
blood.
ma'am,
What?
I have a question. Can I?
Yes.
Ma'am, after a birth baby, we said that there is a wall between atrium. We call call them foramen ovale. Ma'am, we say after birth it closes.
Yes.
But my question
After,
is
yes.
this: my question is that how it closes? What happened there and how it closes? What is the action there?
Yes. It's good question. Yes, I never think about that. Maybe there will be hyperplasia. Yes, of there will be the number of muscles, cardiac muscle cells will increase and close this wall. Oh, sorry, wall. Oh, how to say? This defect, yes, this defect. Maybe, yes, I guess it is due to hyperplasia. The number of muscles increase,
Increases.
but I should also read about. I don't know really.
Okay, ma'am.
There can be hypertrophy. Yes, there can be hypertrophy. Yes, I guess it is due hyperplasia of muscles.
Ma'am, what is hyperplasia?
Hyperplasia, it is
Increasing of muscle.
increasing in the number of muscles. Yes, muscles they what division of muscles increase. Yes, there is hypertrophy. Yes, and hyperplasia. Yes, yes, there is hyperplasia and hypertrophy. In hypertrophy, there only muscles increase in their size. Yes, but there is no number increase in the number. But in hyperplasia, the size remains normal, but there is increase in the number of muscles.
Ma'am,
Okay.
what is
Thank you.
ductus arteriosus?
What is?
Ductus arteriosus.
Yes, this is also during embryologic what development. There is a blood vessel, which connects pulmonary artery with aorta, Okay, in baby, yes, in embryo, how to
Yes.
say, during pregnancy, the lungs are not functioning, yes,
Yes.
and that's why there's no need to blood to come to flow to the lungs, and that's why yes, the blood from pulmonary artery, it flows to the aorta.
Okay, ma'am.
It is a redistribution of blood, yes, from
Yes.
pulmonary artery into the aorta, and blood doesn't flow to the lungs. Okay,
Yes, ma'am.
this is anastomosis between pulmonary artery and aorta.
Okay, ma'am.
Yes, yes, about murmurs. What is murmur?
Ma'am, murmur is a sound that is produced when blood is pumped from the heart wall, and the sound is enough to hear with the stethoscope.
Is
I
it
think.
pathological or physiological sound?
Ma'am, it's
Yes.
pathological,
Well,
ma'am.
Ma'am,
I think.
no, ma'am, it will be physiological, not pathological, ma'am.
explain me why you think that it's physiological.
Murmur sound, ma'am.
Murmur.
Because
Heart
we can,
murmurs, not
yeah,
blood vessel.
yes, ma'am. Because we can find the heartbeat from it also. If we put our hand in the apex of the heart, we can
What? You
we
can
can
what?
Ma'am,
feel that sound.
ma'am,
You can
it's
feel that sound.
ma'am, we can say
And
it's normal.
stethoscope, ma'am.
When you put your hands, yes, on what?
Radial artery or radial.
No, that is
No,
arterial pulsation, I think.
no. Now we are talking heart murmurs. Heart murmurs. The sound, the murmur of sound, which appears in the chest wall. Okay, in the chest wall. And do you know the sites of auscultation?
It may be, ma'am.
Ma'am, murmur is like loved up. These are two sounds which we can hear.
No. Students, don't mix. Laptop we call heart sound. Yes, S1, S2. But murmurs are different.
Okay, ma'am.
Murmurs, it is what?
It
Pathological
will be
sound.
pathological, yeah.
Yes, it is pathological. It is only pathological. Yes, after birth also we can hear murmurs, but
Yes,
yes,
ma'am.
up to what? Due to presence of foramen ovale, we can hear murmurs, and also there will be physiological insufficiency of valves during after birth. Yes, till 1 or 2 months. It's
Ma'am,
normal.
murmur
But
are harmful or not?
murmurs, of course, these are pathological heart sounds, and I want to ask what is the cause of appearance of murmurs? Yes, during which conditions we hear murmurs?
When the heart is filling with blood, diastolic murmur, I think.
Mm, no, it is pathological, I'm saying, yes.
Yeah, it's pathological. When the heart is filling with blood, it is diastolic murmur, and where the heart is emptying, it is systolic murmur.
mm,
And wherever it is throughout the heart, it will be continuous murmur.
yes. But you don't say me why this happens. What causes this? Turbulent flow, yes? Turbulent flow of blood causes appearance of this sound, murmur. But this turbulence
Okay.
happens when, in which conditions? The main,
Turbulent flow, ma'am.
yes, the main cause of murmurs is what?
Ma'am, it can also be caused by heart valves infection. I think so.
Yes, due to this is valvular, yes, valvular dysfunction. When heart valves open or close not properly, yes, it causes appearance of murmurs. Okay,
Okay, ma'am.
valvular disorders of valves. So look, we have two
We
kind
can
of
say
conditions,
hardening of valves. Hardening of valves.
two types of heart disorder, valve disorders. These are stenosis and second
Yes, ma'am.
what? Insufficiency, yes?
Wear and tear.
No, stenosis and
Okay, ma'am.
insufficiency. During stenosis,
Okay, ma'am.
heart valve open not properly. Okay, there the orifice of valve becomes narrow. Okay, and during insufficiency,
ma'am.
they are closed not properly. And yes, there can be backflow of blood. Okay, when they close not
Okay, ma'am.
properly, yes, there can be backflow of blood. We call this regurgitation. Yes.
Ma'am, it is only about the aortic valve or about all valves of our heart,
All
like
valves, about
mitral
all
valve
valves.
and
Yes, all
This is
valves.
continue, ma'am. I think so.
This is about all valves. No, you have different conditions. Yes, some people might have only aortic stenosis, yes, or aortic
Yeah.
insufficiency. Yes, some may have two or three valve disorders. Yes, that's why. According to that, we divide systolic, for example, systolic. Yes, systolic murmur we hear during systole of ventricles when there is a aortic stenosis. Yes,
Okay, ma'am.
aortic valve open not properly, and there is narrow of orifice. Orifice is very narrow, and when blood is pumped, it flows through this narrow orifice and creates turbulent flow. Yes, and this turbulent flow we hear as systolic murmur. Okay,
Okay, ma'am.
and for diastolic can be during insufficiency of aortic valve. During diastole, this aortic valve close not properly, and we see backflow of blood, yes, from aorta back into ventricles during diastole. That's why, yes, we can hear this diastolic murmur, yes, which happens during diastole. Okay,
yes, ma'am.
and if we say about
Ma'am.
mitral valve, for example, mitral stenosis, which murmur we hear during mitral stenosis, systolic or diastolic?
During which, ma'am?
Mitral stenosis.
During systole, ma'am. I think so. No, no,
Think
no, no.
again.
Diastole, diastole,
During,
diastole.
during mitral stenosis, when blood moves from atrium into
Ventricle.
ventricles, yes, through the narrow
Systolic.
orifice.
It will be
Systolic.
systolic, I think.
Really, think again. When blood flows from atrium into the ventricles through narrow orifice.
So, ma'am, we are talking about ventricle systole or atrium.
Yeah, we say when we say systole and diastole, we talk only about ventricles.
Then it will be diastolic.
Yes, it will be diastole. Yes, because during diastole, blood
The
flows from
ventricle
atrium.
relaxes
Yes,
and take
from
blood from atriums.
yes. Understood?
Yes, ma'am.
Yes, cardiac cycle also we relate only to ventricles. Systole, we say systole of ventricles. Diastole, we say
Okay, ma'am.
systole of ventricles. Okay.
When we talk about systole and diastole, it may as well be about ventricles.
Yes.
Okay, ma'am. Now it's clear.
And ECG. Yes, let's talk about ECG now. Let me share. Yes, ECG,
Ma'am,
we can understand
ma'am,
if you don't know
ma'am,
conducting system. Yeah.
ma'am, I think we didn't take any lecture about ECG. Can you
Yes,
just teach us about excitation of heart last time, which we done tomorrow lecture excitation of heart, how its sound produce, how impulses are produced, how it's generated.
um, oh, students. Then
Ma'am, it
when we
is
will
so
discuss,
I think there are just 20 minutes remaining. ECG are a very long topic. It's cannot be covered in these 20 minutes.
no, ECG in second semester, you will discuss only leads. Yes, leads, components of ECG, and that's all. Yes, we don't
Just
discuss
leads, but ma'am, we have
interpretation.
to we have to study mechanism because it's physiology.
Yes, if you want to excitation to go to back.
कलीम भाई आपका क्या हाल है? हामिद भाई
यार ये चीज पढ़ने दे, फिर मैम रोहिना ने वैसे वो पढ़ाना है।
वो तो वैसे हम थोड़ा बहुत कंसेप्ट है, चलेंगे ऐसे आप कहीं, वैसे ठीक है।
नहीं, मैं बोल रहा हूँ मैम जब ईसीजी बोलेगी ना तब हम खुद रीड कर लेंगे। अब ये ईसीजी बोलेगी तो उसको तो कुछ नहीं आता। मैं बोल रहा हूँ ये हम एक्साइटेशन ऑफ हार्ट कर देंगे, जैसा कि एवरी नोट ऐसे नोट जैसा कि कल हमने किया था।
Yes, students, AC note, AV note, yes, you know this, yes, conducting system.
यार वो तो चैप्टर 10 में है मेरे ख्याल में।
तो पढ़ लिया आई थिंक हमने।
हाँ पढ़ लिया है ना, यही तो बोल रहा हूँ ना। अब अगर ये वाला टॉपिक हमारा हो जाता है ईसीजी वाला, तो परसों ये हमारे साथ ईसीजी में क्वेश्चन नहीं करेंगी।
ये ईसीजी है मेरे ख्याल में 11 चैप्टर में।
हाँ, मेरा मतलब ये है जब आज हम ईसीजी करेंगे तो ये ईसीजी के टॉपिक को खत्म करेगी, फिर कल क्वेश्चन नहीं करेगी। लेकिन अगर आज हम खत्म ना करें तो नेक्स्ट लेक्चर में ये हमसे ईसीजी में पूछेगी, तो फिर ईसीजी हमारा सही तरीके से याद भी
No,
होगा।
students, ECG you will not have in lectures. It is only for practice classes. We don't have any lecture about ECG.
अब आपको समझ ना आ रही।
Yes, this is only
Yes, ma'am, we
practice
don't
class
have a
topic.
lecture.
Yes, this is only practice class topic.
Okay, ma'am, you carry on, ma'am.
Okay, ma'am, let's continue with ECG.
Okay, ma'am, you carry on, please. Thank you.
Yes, this is electrocardiogram, yes?
Yes, ma'am.
Have you
Yes,
ever
ma'am.
seen this in
Yes,
your
ma'am.
life? Yes,
Yes, ma'am, in hospitals.
yes,
Yes, ma'am.
you have. Okay.
When this line stretches, the men go to.
Go to
You
hell.
mean isoelectric line, you mean?
No, the men go to Saudi Arabia.
Okay. So in standard electrocardiogram, how many leads there are?
2.
No, 12
No,
leads.
12 leads, yes. 12 leads, 3 groups of leads, yes. Standard leads from the lymph, yes. 1, 2, first, second, and third. And we have augmented leads from the lymph, yes. Here, AVR, AVL, and AVF. And we have 6 chest leads, F1, V1, V2, V3, V4, and V5, V6. So total there are 12 leads. Yes. So 12 leads. In the electrocardiogram, you first of all you calculate the rhythm. It is the rhythm from sinus node, yes, or not sinus rhythm. Yes, we hear this. We understand this by the P wave, yes, appearance of P wave here. And then we calculate heart rate. How much is heart rate? Yes. And then you calculate vector ось деген нелі не дечелі main vector, yes, main vector. Third, you calculate it is heart is located in its original space, or it is shifted, yes, to the left or to the right. And then after that you calculate every component, yes, every component, the amplitude and duration of waves, segments, and what complexes, intervals. Okay. Here, yes, how we get these leads from? We register these electrodes by applying electrodes. Yes, 6 leads. 6 leads we take by applying electrodes to the extremities, yes, to the limb. You can see we apply it here. Yes, here you apply right hand, left hand, and left foot. So these 3 electrodes will give you 6 leads. Okay, 6 leads. And we apply chest electrodes. Yes, 6 of them you apply to chest electrodes here. Yes, V1 you apply in the 4th intercostal space. Yes, from the right and left side. And then we apply V4 on the 5th intercostal space, and then V3 between them, and V5 and V6. And you see that each electrode can show the area, yes, different area of heart. For example, V1, you can see here septum, interventricular septum, yes. Right part, yes, right part of heart. V3, V4, you see anterior part of heart, yes, and V5 and V6, you see lateral inferior part of heart. And we have also can apply additional electrodes, V7, V8, V9, yes, to see the back what surface, back posterior part of heart, yes. But in standard ECG, you apply only 6 electrodes. Okay. So first electrode, you see registration electrode. Yes, first one, negative electrode. It is on right hand. Positive, it is on the left hand. Yes, we see then first standard lead. Yes, and it goes like this. Yes. Second, you apply negative to the yes, understood. Like this, you AV was augmented leads. It means yes, they are augmented by the negative electrodes, and a registration electrode, it is located here. If it is AVF, it means on the foot. Yes. If it is AVL, it means the registration electrode, it is on the left hand. Yes, that's why L. Yes. And if it is on the right hand, it is AVR. Yes. Okay, is it clear with electrodes?
Yes, ma'am.
Okay.
Ma'am,
And
when
yes.
we put electrodes on our hands or on chest, yeah, foot, from where it gets signals, yeah, from where it get impulses to get result.
Yes, here you can see here. You apply on right hand. Yes, on right hand,
Yes,
it means it is, yes, it can you can imagine that it is put in here. Yes, it doesn't matter where you put, but your body is electrical what conductance. Yes, it has a ability of conductivity. Yes, and it doesn't matter where you apply, it will register. Electrode will
ma'am,
register.
how my question is that how it take impulse from the body?
How we take impulse from the body?
Yeah, what is mechanism of action?
Electrode, yes, electrode, it is machine which takes electrode impulses. I don't know, I'm not physician, physic. Yes, but electrodes, this is machine which registers your electrical activity. Yes, for example, yes, we have micro electrodes that measures the activity, voltage activity of cell, yes, like this. Wait. We put this, yes, and here is machine which shows that we have negative and positive numbers, yes, which show. And when you put the electrode, of course, it registers. Yes, inside the cell, if, for example, if it is at the rest state, there is negatively, yes, charged, and it shows you this negative part, yes, how many is. This is, this is function of machine, yes, to register. I don't know how it registers really. It yes, physicians, they know better about that. Okay, then these electrodes register here the electrical activity in the heart. And first, the impulses are generated in where? In which part of heart?
Arterial part S1.
Yes, in the atrium, in the superior part of atrium near the vena cava, yes, where is located SA node. Yes, here. Yes,
Yes,
here.
ma'am.
And then impulses spread to the atrial muscles, yes, and cause depolarization of atrial muscle fibers,
Yes, ma'am.
yes. And this appears on ECG as P wave.
Ma'am, what's mean by depolarization of heart muscle?
Depolarization, it means change in the voltage. Yes, depolarization, you know, at the resting state, this is cell. Yes, you
Yes.
imagine. At the resting state, it is negatively charged. Resting state means that if there is no impulse applied to this cell. Yes?
Ma'am, we say normally in cell we have minus 75 charge.
Yes,
Normally,
minus. In the cardiac
as
muscle, it is around minus 90, yes?
yes, okay,
More
ma'am.
negative, yes, minus 90. When there is a impulse,
So the
this
heart
is
will take more
electrical.
power, ma'am, for depolarization.
Uh, yes,
It
yes,
will
it is
take more
more.
energy.
Yes, because yes, threshold level, it is around 50. Yes, in cardiac muscle, it is around 50. Yes, it means that there should be impulse should have a voltage around 40 millivolts.
Ma'am, we say when the SA node produce impulse, it
Yes,
directly give the impulse to the left atrium,
yes,
first of all. But why it doesn't give the impulse to the AV node directly? Why it doesn't give impulse to his own chamber? It directly give the impulse to the left atrium.
atrium. And yes, this stimulus, it is electrical impulse.
Now,
Yes,
ma'am,
when
I
electrical
have a
impulse.
question that why SA node directly give impulse to the left atrium from right atrium? It doesn't allow its impulse to the his own chamber. It directly allow to the left atrium. Why?
Not directly. Impulses are spread, look, from right atrium. Yes, impulses spread not only to the left atrium, it
Yeah,
also
not to the left
to
atrium,
the,
but first of all, it directly gave to the left atrium.
Because ma'am, both arteries
uh,
contact at the same time.
After
That is
that,
it.
it can give impulse to the AV node through intranodal pathways.
no, students, no. It gives directly to all parts, in all directions. So from up, yes, I have drawn here. First, no, it doesn't give first to the left artery. It gives at the same time. Okay,
Okay,
but
ma'am.
the
As
impulse
we know,
conduction, it is different
ma'am,
in every part.
as we know, the AV node collect the impulse from the SA node. Is there any
Yeah.
receiving point in left atrium for collecting the impulse?
Yes, I said yes. There are fibers which are called Bachmann's fibers. Yes, Bachmann's. It means yes, from SA node start fibers which transmit impulses to the left atrium and to other parts of right atrium.
Okay, ma'am.
These are called Bachmann's fibers. Okay.
Okay.
And also we have internodal fibers from which impulse spread to
Pathways.
from AV node to the from SA node to AV node.
After that, it goes to right bundle branch and left bundle
Yes,
branch.
yes. From AV node then goes to the bundle of his branches. Yes, and etc. So what happens? Depolarization means yes, this electrical impulse reaches, for example, atrial muscle fiber, yes, which are in the resting state, and causes what change in the membrane potential. Yes, inside there will be opening of sodium channels. Yes, and sodium starts to move inside. And it is positively charged, and that's why it starts to change this negative into positive. Yes, like this. And when they reach the threshold level, minus 50 inside, yes, it was minus 90. But when it changes up to minus 50, it opens more voltage gated channels and more sodium starts to flow in, yes, and depolarize membrane. Depolarization, it means change membrane potential from negative to positive. Okay?
Okay.
Depolarization is change of
And
membrane from negative to positive.
ma'am, normally when we say the cell is in rest position and the negative charge inside the cell increase as compared to outside.
Yes.
Oh,
Inside
so
charge.
at that time, what happened? That cell open has open has voltage gated channels and the positive charge come inside.
Yes.
I'm just asking what happened there when the cell open their channels.
Open channels, yes, more positive ions will move inside. Yes. As comparing to the negative charge, there will be more positive charged ions. Yes, and that's why inside will be a turn, yes, from negative to positive charge. From voltage turns, yes, from
My
negative.
question is this: that why depolarization occur simply?
Students, if inside the cell there are positive number, yes, concentration of positive ions increases, then how will it become charged? Positively, yes.
No, ma'am. My question is that the cell normally is in rest position. We say
Yes,
inside charge is negative, outside charge is positive.
yes. Now
But we
outside,
say,
yes.
but we say in depolarization, the voltage gated channels open and the positive charge come inside. But my question is that why depolarization occur? Why this positive charge come inside, or why the voltage channel are opened, and how it is opened?
Yes, opened because of electrical impulse. Yes, electrical impulse reaches this cell, and we have leaky channels. You know, leaky channels for sodium without gates. Okay, leaky channels for potassium. And when impulse comes, yes, electrical impulse, it causes movement of this sodium ions from leaky channels. Leaky means they don't have any gates.
Okay.
Yes, it can be, yes. For example, if we apply mechanical stimulus, for example, yes, when we pressure, yes, pressure. When we apply pressure, this also white. These leaky channels become white and causes movement of sodium ions from outside into the cell. And yes, local, there will be change in the local membrane potential. Yes, and when yes, it reaches this minus 50, it opens these gated channels. Now there will be opening of gated channels, not leaky channels. Okay, understood?
Yeah.
Leaky channels and voltage gated channels, they are different. From leaky channels, ions can move freely because they don't have gates. Okay?
Okay, ma'am.
Yes. And yes, depolarization. There will be depolarization of atrial muscles, and we see as P wave, yes, on the electrocardiogram.
Ma'am, can you take attendance again?
Attendance, why?
Ma'am, Muhammad Bilal also present in class. When you take attendance, he join.
Ahmad, who? Ahmad.
Umar Bilal Umar.
Umar, Muhammad Bilal. Okay.
Ma'am, I am also present, but Umar bus can take me attendance.
Okay, Umar, Muhammad
Bank
Bilal.
number
Yes.
Yes, ma'am.
Yes, change. Yes, I corrected. You are present. Yes, and after that,
and Muhammad Kaleem, ma'am.
Muhammad Kalim. Yes,
Yes,
you
ma'am.
are here. Here.
Yes,
Hayat
ma'am.
Umar is absent today.
Yes, ma'am.
Hayat Ahmar, sorry, Hayat Ahmar is absent.
Okay, ma'am.
Yes, after depolarization of atrial muscles, impulse reach AV node. Yes, AV node, and in AV node, it shows what horizontal line. This is on the isoelectric line. Do you know what is isoelectric line? This horizontal line, yes. In the ECG, we have horizontal line, which is not what drawn, but we know that there is horizontal line, yes, isoelectric line. Waves which are above this line we call positive wave. These are P, R, and T. Yes, they are above of this isoelectric line, and that's why we call them positive. Waves which are under, we call them negative. This is Q and S. Yes, Q and S, they are negative. And isoelectric line means shows that there is no electrical activity. Yes, and PQ, yes, PQ, it falls on this isoelectric line. Why? Because what PQ segment, AV node, yes, this is shows the AV node. It is short, yes, short and small, and that's why, as comparing to atrial muscles, yes, atrium and ventricles, it is very short and small, and that's why electrical machine doesn't register any electrical activity in the AV node. Okay, that's why we see AV node as PQ wave in the ECG. Okay.
Okay, ma'am.
And
Okay,
after
ma'am.
that, from AV node, impulses spread to the bundle of his branches, yes, branches on this bundle, and there will be depolarization of interventricular septum, yes, here. Yes, and we see this as Q wave. Okay, and after that, there will be depolarization of apex, yes, apex of the heart. We see it as R wave, and after that, there will be depolarization of lateral wall, yes, towards the base of heart, yes, and we see this as S wave. These are by Purkinje fibers, yes, these impulses are transported by Purkinje fibers. The walls of ventricles are depolarized, yes, QRS, it means ventricular depolarization, yes, Q, it is interventricular septum, R, it is apex, and S, it is lateral wall, yes, close to the atriums, the walls which are close to the atriums. Okay, and after depolarization, of course, there will be repolarization. Yes, do you know repolarization?
Yes, ma'am. Again,
Yes, ma'am. Again, it's
To
time
change
side of
negative, yes,
is
from
more
positive it's
yes,
changed.
ma'am. Negative proportion.
Yes, due
हमारे
to
लीडर को सिर्फ यही आता था
sodium, no, it's
Barakallah.
potassium movement. Yes, potassium starts to leave the cell, and that's why it again returns back to negative. Yes, and it is registered as T wave. Okay,
okay, ma'am.
and this
yes ma'am okay
cycles goes on, and from one R, from R wave to the next R wave, we call one cardiac cycle. Okay.
Yes, ma'am.
Okay, ma'am.
okay ma'am
Okay, that's all, students. On Moodle platform, there's a quiz about this topic, cardiac cycle and ECG. Solve them.
Okay, ma'am.
okay ma'am We will, inshallah.
Yes, that's all. For the next class, students prepare regulation of cardiovascular system. This is the last our topic.
Regulation
Okay,
of
ma'am.
cardiovascular system, just this, ma'am.
Regulation, we have nervous regulation, yes, humoral regulation, extrinsic, intrinsic regulation.
Okay,
my
sure.
regulation of heart something. Okay, ma'am.
Yes, you will
Okay, ma'am.
learn about regulation of heart activity separately and regulation of blood vessels separately. Okay?
Okay, ma'am. Okay.
Mhm.
Okay, ma'am.
See you next class.
Thank you,
See
ma'am.
you. Thank
See
you,
you.
ma'am.